Good afternoon. My name is Irene O'Donnell, and I'm from Mystic Valley Elder Services. I'm the director of the SHINE program there. SHINE stands for Serving the Health Insurance Needs of Everyone, and that means everyone who's on Medicare, no matter what their age is. SHINE provides free and unbiased insurance information and counseling to Medicare beneficiaries of all ages. We are not aligned with any one insurance company. We answer everybody's questions. Whatever they have for questions, we're glad to help out. In Massachusetts, we have over 600 SHINE counselors, all of whom are trained with a 60-hour certification training program. They go to monthly training meetings and they're recertified every year. So there's a lot invested in the counselors, and the counselors invest a lot of their time into the program. SHINE counselors typically are at senior centers. You may find us at some apartment buildings and also at some community hospitals and community-based sites as well. Today's October 15th, and it's the first day of Medicare's open enrollment. And so this gets to be our busy time of the year. This is the time of the year when people who want to make changes to their Medicare plans, to their drug plans and the Medicare Advantage plans, this is the open enrollment time to do that. Open enrollment goes from October 15th to December 7th. And so that's, again, when Medicare beneficiaries can make changes to their plans. The coverage begins in January of 2014. And the decisions are made during the open enrollment time. When one takes Medicare, you can have Medicare, there's two routes to take. There's original Medicare, which is the traditional Medicare, or you can choose a Medicare Advantage plan. So let me explain that a little bit to you. First of all, I always tell people, you're not making a lifetime decision when you're making your choices of which road to take with your Medicare. During open enrollment is when you can change your mind about what drug plans you want and what health plans that you want. So under traditional Medicare, you would have Medicare A, and Medicare A covers you when you're in the hospital. That's the part of Medicare that you pay for when you've been working. It comes out of your paycheck every week. So by the time most people are eligible for Medicare, they don't pay a premium for Part A. When they sign up for Part A, it's premium free, again, for most people. Covers them when they're in the hospital. Medicare Part B, that is the part of Medicare that covers you for doctor's visits and outpatients, so outpatient therapy, and any doctor's visits would be covered by Medicare. Medicare typically only pays about 80%. It was always designed to do that. That's nothing new. Go to a doctor's office and the visit is $100, then and Medicare approves that $100, they'll pay $80, and you're responsible for the other $20 or 20%. If you have a supplement insurance policy, it would pick up the 20%. If you don't, then you'd be responsible for that balance yourself. So that's Medicare A and B. The next part of Medicare is Part D. D is in drugs. Up until 2006, Medicare did not have any coverage for outpatient prescription drug costs. For most people, they were paying for those all on their own. So starting in 2006, Part D came into play. The other part of Medicare is the Medigap or the supplement plans. Those are private insurance plans. You don't have to take a supplement plan. You completely can make the choice about whether or not you want that, but if not, then you are responsible for those balances that Medicare does not pay for. Part D, the drug coverage, although technically it's a voluntary program, and it says that in your Medicare and You book, if you don't take it, however, and you decide to take it a couple of years down the line, you will pay a penalty for all the time you should have been in a drug plan and you weren't in a drug plan. So keep that in mind when you're making a decision. We will inform you that it's completely your choice whether or not to do that. If you don't take any medications, you might want to wait, but you should know that there is a penalty and it's a lifetime penalty. So that's original Medicare. The other choices are Medicare Advantage plans. Those are the HMOs of Medicare. Works just like every other HMO. There's a network, there's referrals, there's co-pays. You still have to have Medicare A and B, and you still have to pay your Part B premium. But then you would sign up with an HMO plan. There's Tufts, there's Blue Cross, there's Fallon, there's several plans. And that would be how you would get your health care coverage and your drug coverage as well. You can get Medicare Advantage plans with or without Part D coverage. But if you want Part D coverage, your drug coverage, and you want a Medicare Advantage plan, you have to take it with the plan that you choose, okay? And it's the same rules as Part D. If you don't take it, and you eventually take it, you know, a year or two down the line, you would pay a penalty for that. So there are advantages and disadvantages to Medicare Advantage plan versus original Medicare, and we're going to talk about that a little bit later. Medicare Part B now covers a lot of preventive benefits. Prior to the Affordable Care Act, you had to pay for a lot of preventive screenings. Now Medicare Part B pays for many, many of those screenings. Mammograms and diabetes testing, bone mass testing, obesity screening, depression screening, annual wellness visit, that's all covered under Medicare Part B. Keep in mind that Medicare does not, never has, and hopefully someday will, does not pay for your annual physical. The annual wellness visit, which is something that came about a couple of years ago, is a visit with you and your primary care physician to assess your health situation, your family history, medical history. Perhaps there's a history of heart disease in your family. Then what your doctor would do is go through the preventive benefits and say, okay, over the next few years, we should make sure you have a stress test, and maybe there's certain blood tests. It gets you on a schedule for preventive screenings because of your family history. But it is not a real physical. So Medicare does not cover an annual physical. It never did. And a lot of people don't realize that. When you first join Medicare, you are eligible for a Welcome to Medicare physical during the first 12 months that you're in Medicare. It can only happen during those first 12 months. If you didn't take advantage of it during those first 12 months, you missed your opportunity to do that, okay? The other thing with Medicare is that, again, during open enrollment, there are options to do. If you're currently in a Medicare Advantage plan, perhaps there's a reason that you might want to change your Medicare Advantage plan. Perhaps the rates went up this year and you want to switch to another plan. Or your doctor maybe doesn't take that Medicare Advantage plan anymore and you want to switch to another Medicare Advantage plan. You can do that. Or if you're in original Medicare and you want to switch to a Medicare Advantage plan, this is the time of the year to do that. The Medicare supplement plans that I was talking about that pick up the 20% balance that original Medicare doesn't cover, that's open enrollment all year round. You're not tied into the open enrollment period of October 15th to December 7th for these supplement plans. There are several companies that provide coverage. Again, it's Blue Cross, it's Tufts, it's Fallon, Harvard Pilgrim. I brought handouts of all the Medicare Advantage plans in this area and also the supplement plans. The supplement plans, just so you know, not only do they have continuous open enrollment, they're mandated in Massachusetts to have the exact same coverage from company to company. But the premiums are all over the place. So just because you're paying more, you're not getting more of a benefit for that. A lot of people don't realize that. I hate to see people spending money that they don't need to spend, okay? So keep that in mind. With the supplement plans, you don't have a network. Anybody who takes Medicare will take your supplement plan. You can use it anywhere in the country, so you don't have to be restricted by a network or by a location. So if you travel a lot, I always give the example of if you go to Florida for 2 or 3 months in the winter, you probably want a supplement plan instead of taking a Medicare Advantage plan. Because if you have a Medicare Advantage plan and you're in Florida in the middle of the winter and you sprain your ankle, you'll have emergency room coverage. But anything else after that, it'd be all out of pocket for you. You would not have coverage for that. So it's important to think of your lifestyle as well, okay? Another example of why one might want to take a supplement plan versus a Medicare Advantage plan. Let's say you're having knee replacement surgery. And as you know or may know from some of your friends that you'll have a lot of outpatient therapy after a hip replacement or knee replacement surgery. If you have a Medicare Advantage plan, you're going to be paying a lot of co-pays every time you go for a PT treatment on outpatient basis. If you've got a supplement plan, you're not paying any co-pays at all. And at $20 or $25 every time you go for an outpatient physical therapy treatment, that can be pretty expensive. So again, we don't always know what's in front of us, but if you know you have a planned surgery coming up like hip replacement or knee replacement, that might be the year to switch to a supplement plan, get out of the Medicare Advantage plan, and you can always change your mind again the next year, okay? Medicare Advantage plans, again, they are HMOs and PPOs. The HMOs are a little more restrictive. Again, they are through private companies. It's Blue Cross, it's AARP, it's Tufts, it's Fallon, it's all names that you know. It's private companies who are managing Medicare for Medicare. So Medicare has a contract with these companies to manage Medicare for them. Again, with the HMO, it's very, very restrictive with the network and referrals. With the PPO, you have a little more flexibility. Typically, you can go out of network with a PPO, but you will pay a higher copay. So if you pay a copay of, let's say, $15 for your primary care physician with your PPO, but your primary care physician happens to be out of network for that PPO, you might pay $25 every time you go to see the physician, but you still have the flexibility to do that. A little bit of caution with the PPOs that I actually just learned this year myself is that although you can go out of network with them, not all physician offices bill all the Medicare Advantage plans if they're not in network with them. So although you have the flexibility to go to a provider outside of the network with the PPO, that provider may not have a contract to bill to that insurance company. So you may end up paying some money out of pocket and then have to get reimbursed from the insurance company. So it's a little more paperwork, a little more money up front that you would have to pay. So those are the things that you want to keep in mind when choosing Medicare Advantage plan versus a original Medicare, in which you pick up a supplement plan and a standalone drug coverage. Let's talk a little bit about Part D. That's the drug coverage in Medicare, and as I said, prior to 2006, it didn't exist. So the good news is we have a drug plan, we have drug coverage. It's probably one of the most confusing parts of Medicare, because unlike when we're working and we have group health insurance through our work, whatever drug plan is bundled into the insurance plan that you have for your health and hospital coverage is the plan that you take. One size fits all. Not so with Medicare. It's pretty customized. You really choose your plan by the medications that you take. So yours could be different, yours could be different, yours could be different, mine could be different by the medications that we take. It's very individual. There's no family coverage in Medicare. It's all individual coverage. So we will ask our beneficiaries to fill out a pre-enrollment form that they can send in to us or bring to a Shine appointment and list all their medications. When you come to a Shine appointment with that, we will also screen you to see if you qualify for any state or federal programs to help you pay for your drug coverage or your health cost coverage. So the pre-enrollment form is the form that we use to gather all your information, and Medicare has a wonderful website where we can put the information in. It will give us some choices, and rather than you looking at 32 different standalone drug plans, we'll give you a report with 3 drug plans, and they're sorted in the order of the lowest estimated annual cost. And you can compare apples to apples to apples with plans that cover your medications. So Part D covers all prescription outpatient drugs that are in the formularies, and the formularies are the drugs that the companies accept into their plans, and they're by different tiers. Tiers 1, 2, 3, 5, you've seen those. If you have Medicare A or B, you're then eligible for a Part D plan. And you can get your Part D coverage either through a standalone drug plan, if you're in original Medicare, or you would bundle it in with the Medicare Advantage plan. All Medicare drug plans have something in common. They all have premiums. They all have deductibles, although the deductible can be 0, but it's 0 up to $310 for the year 2014. This year the deductible was $325, so the deductible went down for next year, so that's encouraging. They'll have co-pays and co-insurance, so when you go to the pharmacy to pick up your prescriptions, that's when you would be paying your co-pay or your co-insurance, depending on the tier of the drug. And there could be restrictions, quantity limits, prior authorizations, a step therapy with the drugs. Many of the plans have some kind of restrictions now. There aren't very many plans that don't have some restrictions on them. That doesn't mean they're not good. You just need to be aware of the fact that that's an issue, and there might be some extra paperwork for the physicians to do. But the coverage is pretty good with all of the plans. The prices can actually change throughout the year. Certainly during open enrollment, we give you the report from the Medicare Plan Finder of that date and time. But during the year, the retail price of the drugs can vary a little bit, so that's why you'll see the word estimated a lot with those reports. It doesn't go up dramatically, but it can definitely go up. So some changes this year for the Part D coverage. As I said, the deductible went down from $325 down to $310 for the year 2014. The donut hole, are you familiar with the donut hole? The donut hole has been designed into the drug plan when it started in 2006. Between what you spend and what your insurance plan spends as you're purchasing your drugs throughout the year, it's a certain amount of money. And for next year, $2,850. Once that's been spent, you don't have to spend $2,850, but between what your co-pays are and the balance that the insurance company picks up totals $2,850. You then fall into the donut hole. What the donut hole used to mean prior to the Affordable Care Act is that you paid 100% of the cost of your drugs while you were in the donut hole until over $4,000 had been spent. The past couple of years, that has changed. In 2010, when the Affordable Care Act was signed, if you were in the donut hole, you got a rebate of $250. Then some discounts every year have started. So now you're paying about 47% of that brand, 47.5% of that brand name drug instead of 100% like you did a few years ago. The donut hole is shrinking, which is good news. And it is closing, but it won't be closed until the year 2020, so I don't want anybody to celebrate that yet, but it is closing, which is wonderful. I think it's I'm going to call it a design flaw, okay? And it's a good thing that changed, and that did change because of the Affordable Care Act, so that will make a huge difference for people. In Massachusetts, we have a program called Prescription Advantage, which is a state program. It will help you when you're in the donut hole, and for most people, joining Prescription Advantage is free. It only counts your income and not your assets, and that's something that you really should talk to a Shine counselor about if you do fall into the donut hole. So if you find yourself paying more for prescription drugs around July and August every year, you're probably in the donut hole. If you join Prescription Advantage, you'll get even a bigger discount than the discounts I just talked to you about. Also, Prescription Advantage gives you a special enrollment period once per calendar year to change your plan if you want to change your plan for any reason. So it's definitely worth looking into. It doesn't cost you anything to apply, and if you're accepted into the plan, there are those benefits that I just spoke about. So that's something to talk to a Shine counselor about any time of the year, not restricted to open enrollment. Another change for the year 2014 for Part D is that Medicare Part D plans will now cover barbiturates no matter what a person's medical condition is. It was only restricted to certain medical conditions prior to this, so now the Part D plans will cover barbiturates no matter what the medical condition is. Also, if somebody's on Mass Health, what used to happen prior to, so it would still happen for this year, but for 2014, if somebody's on Medicare and Mass Health, starting in 2014, Mass Health will not pay for barbiturates anymore because Medicare is paying for the barbiturates. So they're not losing a benefit, it's just switching to Medicare versus Mass Health. So as I mentioned, there are several assistance programs that people should look into. It doesn't hurt to find out about them. And you might be surprised that more people are qualified for them than they think. There's federal programs and state programs. Extra Help is a federal program to help you pay for your prescription drug coverage. It's income and asset based, and a Shine counselor can pre-screen you for that and help you with the application for that. Social Security, through Social Security, they make the decision on it. We can let you know whether or not we think you're qualified for it. The application flows, and then you get your response back from them. Prescription Advantage is the state program that I just talked about. There's also some programs to help pay for your Part B premium, and also to get some other assistance with your health care costs. So I brought a list with me for you to look at. It's just a general chart of some income guidelines in the different programs, but if it's something you want to look into, certainly speak to the Shine counselor here. Jeff Bemis is the Shine counselor here in North Reading, and he's very happy to help you. And also, you're welcome to, if you want to drive to Malden or call us in Malden. We do a lot of counseling on the phone as well. You don't have to be in person for your Shine counseling. It can be done on the phone. A lot of states just do the counseling on the telephone. Massachusetts is one of the few states that does the most one-on-one, face-to-face counseling. Remember, this is the time of the year to take advantage of changing your plan. If there was any change to your insurance plans this year, you would have received something in the mail in September. I know that everybody gets overwhelmed with mail this time of the year, but if it's from your insurance company, open up that envelope. It's going to let you know if your plan has increased or decreased its premium. It'll also let you know if they're canceling out a plan, so you'll want to make some changes. This is what you want to know about. And maybe the plan that you have for your drug coverage doesn't cover your drugs anymore. Maybe your medications changed a lot from last year until now, and you really need to look at another plan. It doesn't cost you anything to have us do an assessment for you. Plans do change. I know, some people signed up for a plan in 2006 and have stayed with it all this time, and they might be paying way more than they have to pay, just because they didn't want to make any changes. But it doesn't hurt to find out about it, and then you can make your decision, once you know that. And a copy of my handout is on the table over there. There's a list of resources here for you to have. There's the phone number of the Shine office at Mystic Valley Elder Services. There's Medicare's phone number. Mass College of Pharmacy has a wonderful outreach program, and their 800 number is here. They can also help you choose a drug plan. It'll all be done on the phone. But sometimes during open enrollment, we just run out of appointments and times, and there's another way that you can get some help with your drug plan. Medicare will also do this for you on the phone, and they're open 24 hours a day. So if you want to talk to somebody at 3 in the morning, you call 1-800-MEDICARE, and they will help you with your drug plan, okay? The phone number is here for Prescription Advantage. They can actually take an application over the phone, and so that's one way to do that. The Medicare Advocacy Project, they're out of Boston Legal Services, and they're always willing to help with an issue with Medicare that perhaps you can't resolve. You may have brought it to a Shine counselor, or maybe we couldn't resolve it. We would tell you to then call the Medicare Advocacy Project, and they could help you with some assistance if they think that it's a problem that they can do something about. They'll assess the situation and let you know. Any questions that I can answer for you about Medicare, about your plans? No? I guess that's it. Thank you very much.